Okay, hi ladies and gents, my name is Neil O'Grady. I'm a registered osteopath, and today I will demonstrate an MET for the iliopsoas and rectus femoris, commonly known as the hip flexors. So I'm going to ask Jimmy here to sit as close to the edge of the bench as he can without falling off, and to lie back. I have a pillow behind his head and I'm going to lie you back. Bring your knees up and hold the knees with your hands for a moment, and I'm going to put his right foot against my chest, and I get him to interlock both fingers around the knee just to stabilise it. Some people are hypermobile and the leg will drift. So I'll lower the left leg then slowly into this position. And this is a modified Thomas test. So what I'm looking for here is I want to see are the hip flexors tight. And what you would typically see if the iliopsoas were tight is this picture. So the femur is pointing at a 20 to 30 degree angle, pointing up at the ceiling. And if the rectus femoris was tight, because it's not only a hip flexor, because it attaches onto the AIIS, the anterior inferior iliac spine, and into the quadriceps tendon and patella ligament, it extends the knee. So if the rec fem is tight, you'll get this picture. So an angle here of the femur, and also a sort of a straight leg, so the tibia will be almost horizontal as well. Okay, so if I want to stretch this and do an MET on it, what I will do is I'll bring the tibia down or the shin bone, and I'll wrap my foot, my shin bone against Jimmy's foot to keep it in a vertical position, and this will pre-stretch the rec fem. Now what I'll do is I will, keeping close eye contact with Jimmy and communicating with him so I'm not pushing too hard and he's not uncomfortable, I'm going to coax the muscle into a stretch as opposed to forcing it. So it's only gentle pressure, ounces of pressure. So the first thing I'll do is I'll ask you, Jimmy, just to push your left knee, left thigh in an upwards direction into my hand, using about 20% of your strength. 5, 4, 3, 2, 1, and relax. Breathe in and breathe out. And I'm just going to apply a gentle downward force. So I'm pushing down again. So far so good? Okay. So push up again. 5, 4, 3, 2, 1, relax, breathe in, and breathe out. And I might repeat that 3 to 5 times. But again, this shouldn't be sore. It's quite an intense stretch, but it won't be sore. What I found with this stretch is sometimes the person will feel the stretch in the adductors more than the hip flexors. If that is the case and you want to modify it to work, just bring the hip into a little bit more of extension, and that will take the strain, and you just have to push a little bit more inferior or towards the floor here. Okay, so that'll lessen in the stretch here. This is less hip flexion and that. And if you have this picture where you have this, but the leg is hanging vertically, you may not need to pre-stretch the rec fem, so you don't have to necessarily put your foot across the front. You can just do this and push down like that, because the rec fem is not the issue, it's the iliopsoas that you're stretching. So that, ladies and gents, is it. Thank you.